Okay, so in this video, we'll be taking a look at another important topic of pediatrics, that is rheumatic heart disease. So let's get started. About rheumatic heart disease, what you need to remember for your exams is that there is a certain criteria for defining rheumatic heart disease, and this is called as the Jones diagnostic criteria. And in order to label a patient as having rheumatic heart disease, this criteria should fulfill at least two major or one major and two minor, along with having an evidence of recent streptococcal infection in the form of sore throat. So you should have at least two major criteria of Jones, or one major and two minor criteria, along with having an evidence of recent streptococcal infection. So what are the major criteria, out of which two have to be there? Number one is carditis, number two asymmetric migratory polyarthritis, number three chorea, which is a Sydenham chorea, number 4 erythema marginatum, and number 5 subcutaneous nodules. So these 5 are the major criteria, while the minor criteria involve fever, arthralgia, previous rheumatic fever or heart disease, increased ESR CRP, and prolonged PR interval, which can be called as first degree heart block. So there are 5 major and 5 minor criteria. Minor criteria involve fever, arthralgia, previous rheumatic heart disease or rheumatic fever, raised ESR CRP, or prolonged PR interval, also called as first degree heart block. So these will be the symptoms which will be seen in the child. Now, what are the important investigations or the evidence of different manifestations of this disease? Number one, we will try to understand if there is a systemic illness in the child. For that, we will simply order a CBC, which will show leukocytosis, and we will order an ESR and CRP, which will be raised, and these are also the minor criteria of rheumatic heart disease. The second one will the investigation that we're going to be ordering is to identify any evidence of preceding streptococcal infection. Now there are two ways by which we can identify a preceding or a recent streptococcal infection. Number one, we can take a throat swab culture, which will show growth of group A beta hemolytic streptococci, or we can measure the anti-streptolysin O titers or the ASO titers of the antibodies in the blood, which will be rising. So these two will be to identify any evidence of previous streptococcal infection, and number one was to identify any evidence of systemic illness. Now, how will you identify that there is carditis in this patient? Because as you know that there will be pancarditis. Pancarditis means that there will be endocarditis and pericarditis and myocarditis in the patient. So to identify carditis, we do a chest x-ray which will show cardiomegaly, pulmonary congestion, and we will do an ECG which will show first and rarely second degree AV heart block, pericarditis, T-wave inversions, and reduction in the QRS voltages, again due to pericarditis. So these will be the findings of ECG. And echocardiography can also be done, which will show cardiac dilatation and valvular abnormalities. So chest x-ray, ECG, and echocardiography, all these will show the evidence of carditis. So these are the investigations which you need to mention while investigating a case of rheumatic heart disease. Now, once diagnosed, how will you treat a patient medically? Let's take a look at that. So one thing you need to know that the major valves involved by rheumatic heart disease are the aortic valve and mitral valve, and tricuspid valve is mostly involved in IV drug abusers. So it was just an additional information that I wanted to give you guys. Okay, so the medical treatment involves bed rest and supportive treatment, which involves putting the child on IV hydration and giving him adequate caloric intake. Along with that, if there's a acute infection, if there's a current bacterial infection, then we also need to give anti-streptococcal antibiotic therapy in the form of benzathine penicillin or erythromycin. If the child is allergic to penicillin, then we will give erythromycin or cephalosporin. And also we will give anti-inflammatory drugs for arthritis, for carditis, and for that we can give aspirin or prednisolone like steroids. And to treat different complications for chorea, for Sydenham chorea, we give diazepam or haloperidol. Haloperidol is a antipsychotic drug. And for congestive cardiac failure, if that occurs, then we have to give diuretics and digitalis. So these are the general management options that we need to do in the child, or the medical options that we can do: anti-streptococcal therapy, anti-inflammatory drugs, and treatment for various complications. Now, very important thing here is prophylactic therapy. Prophylactic therapy is done with the help of antibiotics, and there are two types of prophylaxis: primary prophylaxis and secondary prophylaxis. So primary prophylaxis involves treating pharyngitis as it occurs. For example, if the child is suffering from pharyngitis, we should try to treat it as early as possible with the help of antibiotics, so that it does not progress to cause rheumatic heart disease, right? So the primary prophylaxis is to treat pharyngitis, and the secondary prophylaxis is the long-term therapy with antibiotics in order to prevent further or recurrent episodes of rheumatic heart disease. So the long-term secondary prophylaxis also involves giving the child antibiotics, like we can give him IM benzathine penicillin, or we can give him oral penicillin V, or sulfadiazine, or erythromycin. So these are the drugs which we can use in long-term prophylactic therapy. So important question which is for many times asked in SEQs as well, that what will be the duration of this long-term prophylaxis. So if the child only suffered with rheumatic fever and there was no heart disease, there was no carditis, then you need to give prophylaxis only for 5 years or 21 years of age, whichever is longer. Okay, but if he had rheumatic fever and there was carditis as well, then you need to give prophylaxis with antibiotics for 10 years or 21 years of age, again whichever is longer. And if the child had rheumatic fever and carditis and he has a residual heart disease, for example, now he is suffering from permanent heart damage, he is having permanent aortic regurgitation, then what we will do, we will give either 10 years of antibiotics or until 40 years of age, whichever is longer. So you need to understand this algorithm. You need to remember this. And in some cases we need to give antibiotics prophylaxis for the rest of the life of the patient. So these were the prophylaxis. Previously we studied the medical therapy, and now we will look at the surgical options which need to be done if the disease is, you can say, whether it is like not supporting life, if the child is suffering from failure to thrive, or if the child is going into congestive heart failure, then there will have to be some surgical management, and it will involve acute valve replacement surgery, pacemaker insertion surgery. Pacemaker insertion is important because we know that in rheumatic heart disease the child also suffers from AV heart block, so pacemaker insertion might also be required. So acute valve replacement, pacemaker insertion. And you need to know that the complications of rheumatic heart disease, the early complications are aortic or mitral regurgitation, and the long-term or chronic complication of rheumatic heart disease includes aortic or mitral stenosis. So long term में stenosis होती है and short term में regurgitation होती है. So these were the few important points regarding rheumatic heart disease that I thought I should teach you. So I hope it was helpful for you guys. Thank you so much for watching.